This video demonstrates a useful technique to reinforce the strength of suture configurations for the repair of challenging radial meniscal tears. The following are our disclosures. After the patient is prepped and draped in the supine position, standard inframedial and infralateral portals are made for access to the knee. After standard diagnostic arthroscopy, a radial tear in the posterior horn/body juncture of the lateral meniscus is identified. An inside-out technique is used here to place vertical mattress stitches along the margins of the radial tear. Alternatively, this can also be done in an all-inside technique using a suture passing device, which will be demonstrated later in a different scenario. The sutures being passed here are tensioned and tied on the outside of the joint capsule. Once that's complete, you can now see the two vertical mattresses along the margins of the tear. Now we are ready to perform our horizontal mattress repair. The next step now is to use a similar needle and cannula to pass more sutures in a horizontal mattress configuration. This is one of the more common ways to repair this type of tear, except here the needle is placed away from the tear on the outer aspect of the vertical mattress stitches that were just placed. Doing that effectively creates a ripstop at the tear margins so that once we tension the repair and tie our knots, we can visualize the suture construct converge the margins of the radial tear without the sutures pulling through. This is useful as oftentimes in suboptimal quality meniscal tissue, the tension and friction of the sutures will cut through the tissue. However, here we see a nice reduction with confidence in our ripstop sutures preventing shredding of the tear edges as the sutures are tensioned and tied. We then visualize and probe the final construct to assure ourselves of a satisfactory and stable repair. Alternatively, the ripstop suture can also be used in a modified or cross-tie grip horizontal mattress configuration as is demonstrated here. The vertical mattress sutures are passed from the superior aspect of one meniscus fragment to the undersurface of the opposite meniscus fragment, effectively crossing the tear. This technique has been shown to have superior displacement and load to failure in biomechanical studies by Nakanishi and colleagues. Here we are demonstrating the utility of a ripstop suture in retracted tears with focal deficiency. You can see here there is significant focal deficiency of the meniscal tissue. In addition, there is suboptimal mobility of the torn edges as we use a grasping device here to pull the edges together. So in this situation, using a traditional vertical mattress would prevent coaptation because the meniscus would be tethered to the capsule. So here we are using an all-inside technique using a self-retrieving suture passing device. In effect, the vertical mattress is kept intrameniscal to create a mobile ripstop that is not limited by incorporation of the capsule. The horizontal mattress component can now be confidently placed and tied, facilitating reduction. Thank you for your time and attention.